If you've noticed your body changing, your energy, your sleep, your mood, and you're quietly wondering, is this normal or is something wrong with me? You're not alone. Many women enter perimenopause and menopause with no preparation, especially when it comes to intimacy and body awareness. And because no one is openly talking about it, we're feeling shame and embarrassment about the changes we're experiencing. So today's conversation is about breaking the silence around intimacy and the journey of perimenopause and menopause. I'm joined by Shakeeka Misher, the founder of Wellness Thryva, who supports women through hormonal transitions with education, compassion, and practical tools. This is a safe, honest conversation about what's happening with our bodies and how to navigate through it in this chapter of life. So it's time to remove the isolation and embarrassment around what's happening with our bodies. By the end of this episode, you'll feel informed, less alone, and more empowered to advocate for your body and have awareness about what's going on. Before we jump into this episode, I just want to share with you some statistics to understand about what's happening. According to the North American Menopause Society, over 1 million women in the United States enter menopause every year. Yet most report feeling undereducated and unsupported, especially around intimacy and sexual health. So if you're feeling confused, disconnected, or unsure how to talk about what's going on, it's not a personal failure. It's a cultural gap. And that's why this conversation matters for you today. Thanks again for being a guest today, Shakeeka.
Thank you. I appreciate the invite.
You're so very welcome. I'm really excited about this conversation because I feel like there's been a lot of elusiveness when it comes to what perimenopause is or menopause. In fact, last week I saw in someone's Facebook post, they were like, I feel like our elders did not tell us what to expect when it comes to, it's like, it felt like, I think a lot of people feel as if it was being gatekept or people just were enduring in silence. How long have you been helping people with just navigating through this part of their life?
Love it. I truly believe it's a mix of both and things from like, have we get gatekeep? Yes, but did we gatekeep intentionally from it? It was the better question from that. And I hear it. So I have been in women's health for the past 18 years from it. And truly, it's my heart, what I love to do. And then during the past 3 years from it, really honing in into perimenopause. One, because I was going through perimenopause and through that journey. And then the second piece, I was a fertility nurse practitioner during that time frame. So a lot of our clients was in their perimenopause stage that felt great when we were going through all of our sins, but not so great afterwards from it. So it became a passion to me that's like, you feel amazing, during this part and, you got the hormones and things back, or you're doing different lifestyle components to get to a step that you're, wanting to achieve. But then after that was over, then they didn't feel that great, like back to where they were. And that was the heartbreaking piece of it. It's like, oh my gosh, like I got into nursing because I wanted to help people. That's my heart, that's my joy from it. So when you working through that process and wanting to help, and you see someone like, oh my gosh, I'm back and I'm hurting again, like that hits at your soul, at your core
Yeah.
from it. So that was our true driving force. And then icing on the cake is when I went through my perimenopause journey and still going through that perimenopause journey. And that dismissal and not feeling heard and seen. And it was like, you know what? I got to be on the other side of this. If there's gotta be a better light at the end of the tunnel, for this for sure.
And I would love for you to even bring some clarity around what is perimenopause and what is like, how is it different than menopause? Because I feel that until someone actually gets diagnosed, we just feel as if our body's changing, but we don't really know what that is. So just for
Mhm.
anyone that this is kind of new territory for them, how would you actually explain it?
Yes, absolutely key. Your body is changing and being able to adapt with it. Perimenopause is before menopause, so it's the years prior to. It can start, especially in women of color, in our mid-30s, for when we start
Wow.
to see that change in occurring signs and symptoms that's happening from it. And you can name it to like, oh, we're busy, or I got a job, or I got kids and other things that's going on. But those changes can occur like in our mid 30s to early 40s. And that can last, 10 years, some longer for women as well too. And menopause is one day. Menopause is when you've been 12 months without a period, no spotting, no full 12 full months. That's your day of menopause, and it's one day. And then that next day after that is postmenopause. That's any time after that 12 months without a period, no bleeding or anything. That's postmenopause. In the postmenopause, you can still have symptoms. Symptoms are actually more even common in that postmenopause, because sometimes we can feel like, oh my gosh, I'm in menopause, or it's truly when someone says I'm in menopause, I'm postmenopause. Remember, menopause is just that one day. And from it,
Mm.
those symptoms can still occur 5, 7, sometimes up to that 10-year time frame. So, you can't feel like it's a light switch that goes on and off, that I'm here, I'm not here. From it can be ongoing and impacts us from the top of our head to the soles of our feet.
From what I heard as well, this could be a 20-year, like, I swear, like, I love being a woman, but um I do feel at times we were given the short end of the stick. Like, oh, you might go through it for 10 years. And then once you hit menopause, it might still be going 10 years after. And I'm curious, like I've seen that even with some of my friends and family members, I have not had children. Is there anything since? Because I haven't actually felt as if I actually started any signs of perimenopause, and I'm 44. However, I have people that are in their 40s that are already like in that. Is there any link to one age, diet, or just even if they've had children or have had some type of situation when it relates to childbirth?
Yes, all of the above can
Okay.
impact it. Family history, genetics, yes, from it can impact. It can give you a cue into it. Unique thing about this journey is same thing when we talk about like you're having children, or this is your pregnancy, and this child A versus child B. And from it, everyone is individual, and their journey is different from
Mm.
it. And I think that can be a hard component because we're like, I don't have this symptom from it. Am I in it? And things from it. There's over 80 symptoms and counting and things from it. You don't have to
Wow.
have every single one of them. Like you asked, is it things that we're eating? Yes. Like think about from our foods, all the hormones that's in our foods from it.
Mhm.
Think about our products in our hair from it, how that disrupts. There's all these endocrine disruptors, things that we're putting into our body, things that's outside in our environment that we're breathing in every single day that
Mhm.
disrupts our hormones from that. So that can be a huge component into seeing in what symptoms that you're having or not having, or those that you've seen, that they're there and they've occurred, but you talked about to something else that may
Mhm.
be going on, or that's my thyroid, or that's my blood pressure here, or no, I'm just stressed and kind of going through it. And it can be all of those things, but being able to name it is important from it.
And I'm glad you mentioned it was 80 symptoms because honestly, when I think of it, most of the people I know that are perimenopause or going through menopause, it's the hot and cold. Like I'm at their house with sweaters wrapped around my body because they are. I'm like, why is it 68 degrees on your thermostat? Like, I'm just like, let me understand how this makes sense. But for them, they're comfortable while everyone else is like feeling like they need a jacket on inside the house. And so it's good that you mentioned the 80 because I feel that sometimes that might also get in the way of us even understanding, if we are in perimenopause because we associate those popular, if we want to say popular symptoms that people can sometimes be suffering from.
Yes, absolutely. And from and it was twofold. It made me think about the power of a communication and
Uh-huh.
that disclaimer that you may need to give to your folks that's coming over to your house, or
Mm.
even that's in your circle, your intimate circle of what you're going through and what you're experiencing. Because these are things internal that someone necessarily can't see on the outside of you. But you're absolutely right. Like hot flashes, the night sweats, we hear that all the time. Oh, you're going through the change, especially culture. Oh,
Yes.
you're going through the change. You'll get through this. Keep going. From while you internally in yourself, I'm like, oh my gosh, how much longer do I need to go? We just talked about 20 years. Do I need to keep pushing that long with those? But there's dry mouth, dry ears, burning mouth syndrome, vaginal dryness from it, which can lead to painful intercourse, joint aches and pains from it, that shoulder pain,
Yeah.
lockjaw that you may get from it can be present, insulin sensitivity, which can result in some weight changes that you may notice. from it. Also, high cholesterol can be a factor that factors into that as well too. So so many components and name. You think about when we think from a hormone standpoint, as I mentioned before, the top of your head to the soles of your feet. It impacts everything within our body. Take a step back and think about perimenopause, our menopause day, and postmenopause. Why it's important to be aware and what's going on into your body because it impacts longevity from it.
Mm.
As your hormones are fluctuating and decreasing, especially our estrogen, it's anti-inflammatory. So those insulin resistant that I just talked about, that shows up where you've been doing totally fine and like, oh, here I am. Here it is. And things from because you've had that dip or the higher cholesterol from it. And he's like, oh, like, what I haven't changed my eating habits. I haven't done this. And sometimes we'll get in that. It's I haven't done where we take it personally that it's something that you asked for or that you intentionally did. And I'm here to tell you, like, absolutely not. From it, this is a natural process. Rather, it happens to you naturally, or it's something that's induced where you have a hysterectomy from it, you have your ovaries removed or surgery that's on it. These
Mhm.
symptoms can be induced earlier than when you would have done went through naturally from that. So it's important to name it, but to not feel that you're the blame from it because you're not. This is nature. From it, we can sometimes like
Yeah.
we are, dealt that short end of the
Yeah.
stick from, but it's nature, and we were all going to be impacted, whether it's directly or indirectly from it.
So is this something that when we're going to get our annuals, I mean, I've never been tested per se. Is this something like if you feel like, okay, something might be going different with me? How do you bring that up to your doctor? Or is it like, how do you get tested? I mean, because I'm sure that that also adds an impact to the unspoken part, is because sometimes we really may just be roaming around outside of those, like, irritability, mood swings, like those big ones that we hear that are stereotypes when it comes to being in that stage of life, how would you go about actually finding out if you are, or bringing this to the attention of someone that maybe I just need to get checked to see if I am?
Oh, great question. What I advocate a lot for clients that come to see me is writing things down.
Mm,
Rather it's paper and pencil. You're a journal girl, I'm from it, or you like it to be on your phone and your apps. I'm from it. Write things down and track them. I'm from it. And symptoms. What things could it be? When am I irritable? I'm from it. When does I have a change in my mood? Or is it certain times a month that I've had headaches and these migraines come in and oh my gosh, it just kind of wipes me out from it, changes in your cycle. And it's important to kind of think about those symptoms pain in your legs from a joint pains that's happening, occurring, or dry mouth, how that aligns up with your cycle. What happens with that information? That information equips you with power, it equips you with so much knowledge for not only you for as an individual, but as you go to see your provider from it. When we ask, is there a test from that we can take that's going to pop out? Yes, this is perimenopause, or no, this is like, no, there's not one definitive test from it. This is a cluster of things. A lot we are diagnosing this based on our symptoms from it.
yeah,
Yes, labs can be pulled into this part, but we're utilizing our labs to rule out other things to make sure is this tied to perimenopause, but make sure we don't have anything going on for our thyroid from it, or no,
okay.
we don't have anything that's going on here. So it's that that collection from it that shows us a big picture with it. If I can give you one huge advice, is writing down those symptoms. And if you have someone else lives with you in the household, have them partner with you as well from it. Sometimes us as individuals, we can get used to our day in and day out process from it that we don't notice the subtle changes that can occur from it, or when we may be irritable one time in a month versus the other. So if you have a partner that's in the household with you, even your children, they notice the difference
Yeah.
as well. Have them to partner with you. It's like, you know what, like write this down, for me, or kind of keep a note, or at least or bring it to my attention and I can write it down from it. Because this is a community, this is a group, and that information can empower you to get the information that you need and the help, that support that you need. When you think about it, and you look at research, women can go to their provider offices having signs and symptoms of perimenopause from it especially, and it can take anywhere from 3 to 7 years time frame. And the
Wow.
reason why that is because, like we mentioned before, that's your thyroid. Oh, like no,
Okay.
you're under this stress, and things are no, you're going through this. I'm from oh, like let's keep trying, and pushing through. Oh, that's just related to your cycle. So you get pushed back and pushed back and pushed back from it. And what that pushback does is that it tears at you
Mm,
internally from it. hands up, both hands up. I've been there. And it's still there from that. It's like you know something is going on with your body, but you can't name it. And that's oftentimes where women will say, I can't name the symptoms that I feel in, but I don't feel like myself. It's like it's different. I can't pinpoint like what it is, but it's different. And that matters from it. I've been able to name that and to write it down and to keep that trend from it as well.
This has a light bulb going off in my head, I'm not gonna lie, because with hearing you say about one, just taking the time to journal and not being able to put your finger on it. One of the things I've even noticed personally about myself, I haven't had like the big things like the irritability and stuff, but I've always had a little bit of issue with anxiousness. But it's been at level 10, and I just assumed because we're in a dumpster fire era right now that's why for the last 5 years, I'm like, I never had that feeling of feeling anxious as much as I have. Literally, like 2 days ago, I'm just like, I've been managing I try to manage like my boundaries and my schedule so that I'm not triggering myself and being very aware of those emotions. But it's almost been to the point where it's made me think maybe I might need to use a prescription. But that may just be because of the stress and how my body and my hormones are shifting now that, I mean, in 3 months, I'll be 45 years old. So I would assume I'm probably in some form of perimenopause being at 45 years old. And when I'm hearing you, that is something that I literally think that I need to talk to my doctor about because I only think of the big things. And I hope anyone that's listening don't only think of the big things because like that's what's opening up for me when I'm hearing from you. I was like, man, yeah, mental health is big, but like I can manage that. But with heat flashes, I can't, I can't change. I have no control over that kind of stuff. But I'm glad that you shared that because I can imagine, even when it comes to intimacy, which we're going to be digging into, is that if we're only thinking about these big things and we're not aware of these small things, and also learning the verbiage to be
Mhm.
able to have people aware that this change is happening, I think is a big part of intimacy because some people can be going around completely unaware of the chaos that they're causing from day to day because they don't ever talk to people about how they are changing without finding an offense and them sharing their experience of them. I hope you've been enjoying the episode thus far, but I want to let you know at the Life Over 40 podcast, we believe that conversations are key to us connecting. And most importantly, we need to have open conversations. This podcast exists so women navigating midlife transitions can feel seen, supported, and informed. Shakeeka's work with Wellness Thryva is deeply aligned with that mission, and I'm grateful for her to be a guest. And we're wanting to remind women that nothing is wrong with you in this season. And if you want to stay connected with this community, make sure to subscribe to our newsletter so that you can stay up to date with new episodes. All right, let's get back to the conversation.
Spot on. Many women, when we think about anxiety or depression, I would say this: many women aren't depressed from it; they're hormonally dysregulated
Mm,
from those, where hormones are on that roller coaster. And antidepressants don't fix estrogen from it. It can help with your mood. It's a great starting point, but it may not be the ending point from it. And then when you mention that, it makes, to be able to advocate for yourself, because 1 in 4 women in midlife are prescribed an antidepressant from it without a hormone evaluation, because it
wow.
is, estrogen directly influences our serotonin, our dopamine, our norepinephrine. So adding in that antidepressant from it can give you that additional support and relief from it. But it may not be exactly what you need from those. So just because you start with something doesn't mean that's your end point.
Mm.
Advocate, speak up for yourself from it. Look out for those mood swings. Look out for the anxiety, panic attacks. Like, oh my goodness, like watch out from the irritability, fog, difficulty sleeping. Whether you can go to sleep really well and you're waking up in the middle of the night, or you can't go to sleep from that, or just emotional. You could be watching a movie and things from it, and you've watched that movie 10 times, but today it hit me hard. It hit me just totally different. and things from it. Like, where did this come from? Like, you've seen this
Yeah.
before, or even situations that you've dealt with over and over before. You adapt and you change from that, and that's because your body is changing. And that's
Mm.
important to identify that as well. And I mean, antidepressants have great points from it of being able to help with that anxiety, the depression components. They can even help with hot flashes if you're
Mm.
having those hot flashes. But if you get into it and it's like, oh my gosh, like this is not working for me, it's a good component. I was just speaking to one of my clients yesterday about it, of understanding just because something is helpful doesn't mean it's optimal. The same thing,
Oh,
just because something is normal doesn't mean it's optimal or right for you. So being able to speak up for yourself and like, like what's that? The big piece in that. And the other thing you mentioned up was like about our libido. Like when we
mm.
add in the antidepressants from it, while they may be helping one things, a lot of them impact our libido even more when you're already having those struggles with libido as well too. So it's good. That roller coaster ride of being able to say, what's in it for me? How do I feel today? How do I want to feel tomorrow and the next day? And am I constantly, moving towards that direction of my longevity, how I want to be?
I think what you just shared was so impactful, and it really gives me things to think about, and I hope that anyone is listening and gives you something to think about. But I feel like sometimes the conversations around this and someone hearing about all of these changes, one of the words that first comes to me is almost like a fear. And the reality of it too is that when we look at dating and partnership, there's a lot of, women that are out there that are single. And I can only imagine the fear of having all of these changes going on and be like, "Hey, but I need you to journal with me as well." And just in case I do spaz out, I might be taking some prescriptions. I can only imagine how to start this conversation with a partner when ultimately I feel like when we're talking about intimacy, vulnerability is a part of it to be able to share this is what I may be going through right now. Hopefully, because everyone's not going to be able to receive that there's these changes going on, but hopefully if we're pairing up with someone that can understand that, like, I can imagine that this can be fearful for some women when it comes to I'm going through these changes, but how do I actually even date or even communicate these changes with someone? Or should I just wait till I'm done with these changes? That's not realistic because we just said 20 years.
No.
Like, I'm not out here to 60, like, just because I don't
Yes.
want to cry, know?
Such great questions and then powerful. You know what it makes me think about? It's just myth busting from it. We have this myth as women that we can think about that, or we play in our minds, or whether someone's told us, or we've heard it or saw it, that if my desire isn't spontaneous, something is wrong. If I
Mm,
see my partner, I'm supposed to be instantly turned on and like, let's go, let's get it from it. But perimenopause changes that from it. It can. And it doesn't mean that you're broken from it. It doesn't mean that something is wrong with you. It's that your body is shifting from it. Hormones fluctuate and stress loads climb from it. Sleep can get choppy and things that's coming on your nervous system. Oh my gosh, it plays all kinds of tricks and things for you. But I always like to talk when we're thinking about like our intimacy standpoint that spontaneous desire isn't the only real desire that's there.
mm,
Sometimes desire shows up after the warmth starts, not before. Then
mm.
that's when it comes important to speak with your partner from it, because they can be like, okay, like she's ready, and from it, I've set the mood, I got it there, like my mind is there, and your mind may be there, but down below may not even be nowhere near close from it. So that
Yeah.
foreplay leading up is important from it. So thinking about spontaneous desire from it, you want it before anything ever starts, versus responsive desire, you become interested after kissing, touching, emotional safety, relaxation, or the pleasure begins. And it's important for you to be able to share that and acknowledge it with your partner from them, and speak with that. And now, oftentimes when I, I'm speaking with a client, so it's like, yo, so, Dr. Shakeeka, when should I, speak with them from it? Not in the
Mhm.
moment. And things from it, like not like not directly in the moment. Like that. Let's not talk about it there. But let's not bring up a full conversation there. Do like some slow, like, okay, that not right now, or let's do this. From our, or what do you think about this standpoint? But when you're in a clear mind and clear heart, from it, and as well as them in that same clear mind and heart, not when they just came home from working and been out all day, finding a good spot that where you can have an open conversation and to be open and with it. And acknowledging, then having them listen to this podcast to let them know, like, hey,
Mhm.
my body is changing. And truth be, their body is changing too. Whether they want to admit it
Yeah.
or not, their body is changing from it. And what's important to acknowledge is takes them, and it also takes yourself from saying, I don't want him or her anymore from it. I just need a different igniting from it, a
Mhm.
different system to ignite me, is what is if to really think about it. Libido is not a single switch. It's a whole dashboard. There's all kinds of buttons and levers and
1,000%.
turns that do it that we can turn on and off from it. So it's important to acknowledge that and to bring it up with compassion and heart in there. Not when your
Mhm.
voice gets louder and things from it. Not when you're frustrated with it, and always encourage when I say like, "Hey, let's not talk about this in the moment." If something is hurting, doesn't feel that great, that's your stop sign and things from it. You don't want to push past that and from it, acknowledge that and like, "Hey, look, let's try something else," or "Well, let's do this." And from it, and then swing back around that and explain like, "This is why we stopped to this point. I'm from, or this is what I was feeling and how I will like for you to partner with me in this." So that you bring them in this together, so it's not just a you thing or them thing. We're in a partnership.
I hear next level of vulnerability that is almost required when it comes to intimacy and going through this next phase. And one of the questions I did have, which this aligns perfectly into this conversation, is because yes, our bodies will be changing. There's going to be things that just are not going to be the same. And intimacy will be evolving while our body is also evolving. But there's going to be this barrier of shame that's going to be present when it comes to actually talking about this. Like,
Oh,
do you
yeah.
find that this is something that some of your clients might come to you and say they're experiencing? Because I feel like you can't hide it. I mean, like, you just can't hide. Like, it's gonna come up to the surface at some point, even if you're faking it or whatever the case is, it's going to become an issue. But how does shame become how is shame a barrier in addressing this issue?
Shame is a huge barrier from it. Shame is a barrier when you're trying to speak with that person that you're intimate with. Shame is a barrier when you are trying to talk to your provider about it. That's a huge
Yeah.
barrier from it. Oftentimes that discussion never happens with your provider because your provider is waiting on you and you're waiting on your provider to ask those questions, so it never gets answered from it. And what I encourage my clients to do is to first have that conversation with yourself. The most person that you're comfortable with, that you know inside and out, is you. So it's that self-talk, whether you journaling, whether you want to talk to yourself out loud from them. I've also found like on your phones, you can do like recorders or even like doing a voice memo, recording yourself, talking to yourself or talking to the person that you want to share that with from them. And that helps to bring down your nervous system, your calmness from it, gives you that confidence to say, okay, because you can stop that, you can play it back and listen to it to see how you sound with it. Did I get everything across from it? It gives you an opportunity to analyze it for yourself. But getting back into that self-heart, that self-talk is so important and so key. And finding you a provider from it, whether it's a medical provider, whether it's a therapist, from it. There's a lot of therapists that really focus on intimacy where you can go through exercises and really talk and unpill it back. Because sometimes we can get into this point, this component like, okay, this is perimenopause that I'm in. But there could be things that happen 5, 10, 15 years before, or even like minutes prior to that's going to impact you in that moment and in the future. And it's important to unpeel those, unpack them for yourself to pull through. The other thing I like that you mentioned is that our libido evolves from it. And it
Mhm.
does. Like sex evolves truly from it. Sometimes we can get into this standpoint is because we're getting older that we shouldn't want it, that desire anymore. No, no,
Mhm.
baby. Like you still want that no, it's still there from it. It may look different from
Yeah.
it, but that drive is still there. And that's important. So as sex evolves, that's not a downgrade. It's actually an upgrade from it. And that's an opportunity for you to pull that in with your partner of how things look different. Going from our old model of performance and spontaneity. Has to be quick. You got to get the orgasm, whether you're it's a true one or you're faking it from it, that desire. I love you. I want you. They always has to be quick and fast, to more into a new model of connection and intention. More warm up, more communication, more pleasure based focused from it, more creativity and less pleasure. So you come that partnership of, this is what I'm thinking from it. What do you think about it? And you may need to introduce things. And that's key and important, is even if you've been with someone 5, 10, 15, how many years it's been, you're going to change over that time frame. They're going to change. What you liked 10 years ago may not be what you like right now. And that's okay to accept that. Your libido does not have to leave from it, but it is asking for a different language. So it's up to us to speak that language to our bodies. And from it, if something's hurting, something's not pleasure, that tells our libido, oh, I'm not safe here. Let me calm down. Let me push everything back down from, because we're not ready. That's your body protecting you. And we want to listen and cater and protect our body for that as well.
And I hear a lot about choice when I'm listening to you. It's like we can either choose to not talk to, like, face that these things are happening. We could choose to not bring it up to our doctors. We can choose to not share it with our partner, or we can actually choose to have the support that we're needing, to have the kind of relationships that we're desiring, the type of intimacy that we're also wanting as well. And it all comes down to choosing, because I feel that sometimes with shame, we focus on not allowing people in or being embarrassed, compared to actually choosing to advocate for ourselves. Because even with doctors, I feel that some people still find themselves falling victim to, like, I go to this doctor because my parent went to this doctor and everyone goes to this doctor and I started with this doctor. Like, no, you can choose which doctor you want to go to. If
Yeah.
like, it's so much power in our choice, and I think that that's something that's really important when we're advocating for ourselves, not just in a medical space, but even just in our day to day.
I agree. And one of the, I'll give you 3 questions. 3 questions I always encourage my clients to ask themselves from it. 1, do I feel comfortable physically? 2, do I feel safe or seen? And 3, do I have the time, privacy, or bandwidth to take this on? If one of those is missing from it, libido isn't gone, but the conditions aren't there. And we got to go back and address those conditions from that as well. And one of the questions you had asked before was like, hey, like, how do I talk to my partner about this? Like, how do I bring this in? How do I make that conversation from it, especially when we're in that moment, or we think we should be in that moment? Instead of asking, I don't know, sometimes, it's us as women. I've done it myself. I've texted my husband. It's 9 o'clock in the morning. Things like, I may be ready. The things are 9 o'clock. He at work. I'm somewhere else. Like, it's ready. But by the time he get home, things are that.
You're like,
Well,
"Don't touch me."
baby, it ain't from it. It ain't like I forgot about it, but it's like the conditions was different. Like, I needed you to be there at 9 o'clock this morning. And they said now that it's different from them. So I always think about rewriting my initiation or my invitation. When I always tell our clients, like, okay, can we cuddle for 10 minutes and see where it goes from there? Which direction we're going to go from that? Or I miss you, but can we reconnect tonight? And just leave it as there, instead of being like me and like we're typing it and we're
Yes.
we're staring things up. Hey, leave it there, and then you see what tonight gets from it. And then just like no pressure. I just want closeness from that. I've been able to open that door up and explore. It's so important and so key. But you're right. Like, just because your parents or somebody else has been to this provider, or just because your insurance is accepted at that provider, doesn't
Yes.
mean that's the provider you need to go to, especially truly across the board. But when you're talking about intimate thing, like, I'm bringing you into something about me from it that's personal, that I want to thrive in. And you've got to feel comfortable to talk to them about the good things, about the bad things, about things that you should suggest or not suggest from him. And you've got to have that comfort with that person to speak. And that trust has to be there as well, too, that I trust what we say in this room is going to stay in this room from it.
Mhm.
And they're not going to look at me differently from, or we're not going to bring this up outside of here, but you're going to support me and to bring that conversation like every time we come in to for a visit. This is what I'm here for. I've been able to check in, even when it may not be the topic of hand from it. And that's one of the things I'm also like, hey, we came here for, just to really talk about our hormones from that. But that plays into it as well. Like, how you feeling? Just because you're
Yeah.
doing it every day doesn't mean you enjoy it from
Yeah.
it. Two totally different things from it. So being able to bring it up and talk about it.
And I think that this is, I would love for our relationships with our medical practitioners evolved. Like, I feel that we have, depending on culture, region, that all plays a part as to how we view doctors. So if we've always had this, okay, I just went, let me go, like we're not building up relationships or rapport. And then that ultimately plays a part in us advocating for ourselves, like to know, like, I need to get some different feedback because, like, I had fibroids, I had them removed. I'm from DC, born and raised, lived there majority of my life. My doctor never said to me that I needed to get a hysterectomy. I moved to Louisiana to take care of my mom and she had terminal cancer, she passed away. Once I was able to finally go to the doctor down in Louisiana, doctor, the first thing he says, "You should just get a hysterectomy." And I'm like, "I've had multiple doctors, and that word and nothing's wrong with getting it done, but it's like, that word hasn't come up." And so then I go to another specialist because 'cause I'm just like, "How do I go from a different region?" That never came up. But then I come here, that's the first thing that's mentioned to me. Then I had to go to
Mhm.
someone else that typically is more of a specialist that usual insurances aren't covered. He's like, "No, that would be easy." I left Louisiana, found another doctor. She's like, a doctor was like, "Oh, it's gonna be a little bit complicated, but we know someone that is great at doing laparoscopic." I was able to get a laparoscopic procedure done. If I would have gone with, and I think Louisiana, they do, I'm I'm gonna say it. I think they do sterilization, but that's just me. That's my perception as someone is there. I'm like, oh, so we're just out here taking away rights. But I went to a whole nother state, and granted, that might not be feasible for someone. You can do this in your own area. Don't just go by what one person says. And I think that while we're going through these changes, I think this is where if you've been passive with your relationships with your medical practitioners, this might be the time in your life where being passive isn't what you need to do. It's like actually finding people that you can connect to, that you feel comfortable with, that you can respect their advice and recommendations. Because I just feel like that needs to shift, especially once we're going into this next stage of our life. Because I would assume like at every stage, there's probably like this change of like, do I still stay with the same doctor?
Mhm. It is, and it's important, like, to identify that and, to name it, from it,
Yeah.
and to get that second opinion, from it. There's all kinds of hairdressers out there. Just because
Yes.
one doesn't fit right and put on, you need to go to a different one. Same thing with your nails. That
Mhm.
happens with your, for medical care, as well too, and not to be pinholed into any type of options. And it's important that you understand what your options are. There's
Yes.
always an A, B, or C option, and being able to identify and explain them in totality from it. Like, what does this mean for me? What is it going to impact from that as well? Because there's tons of women that's like, I've got a hysterectomy. You're great. I'm not having any more cycles and things from it. But then did we talk about what happens because of that from it
Yeah.
and things that we're going to experience? And that's when you need to see the big picture, the full
Yes.
picture of understanding. Specifically when we're speaking about like intimacy and like sexual dysfunction and things as well too, this is not a component to really suffer in silence from it, to be able to
Mm.
find that provider that you can speak with one-on-one from it. Female sexual dysfunction is real from it. It
Mhm.
happens from it. It is persistent sexual desire or arousal, orgasm, or pain that occurs that you didn't ask for or didn't want, and it can impact your quality of life from it. So it's important to seek support for that, to identify someone that can partner with you. There's a ton of research that's out, and one of the things that when it tied into like arousal and dysfunction across, that older women reported more sexual dysfunction at similar rates as midlife women,
Uh,
but they reported less distress from it. And what that meant is that they were suffering in silence does not get you the help that you need. Whether
Yeah.
you're doing it in midlife, whether you're doing it when you're old, it doesn't matter what that time frame is. That hurts you individually. I'm from it
Mhm.
personally down to the core. So being able to normalize our conversations with our clinical providers for
Mhm.
support, to reducing the shame, the stigmas around that, that's important. That's key. Like that's thriving. I'm from it. That desire of connection, like what it sparks in us internally and how
Mhm.
that impacts us from a longevity standpoint. Like, okay, bring it on. Like bring it on. Like it's here. Everything's from it. But you've got to find that connection. And that's just a powerful component of it. And it's life changing for sure.
Is it bad that when I hear sexual disorder, I naturally think or associate that term to men? Like, I wonder if women recognize that that is what's happening. Like with men, it's obvious something isn't working, but I don't like, is that something that can be a thing that women may not be really even associating the change to their libido and things like that as a form of a sexual disorder?
Yes, absolutely. I mean, if you think about it, like across all on the internet streets, all internet things from we hear a lot about men and things
Yeah.
from and their impact. And we've had medications for men for years and years on from it. And women, like we're slowly kind of working our way up
Yeah.
with it, but we're going to keep advocating and we're going to have like there's so much we've gotten a lot of strides and things from it. So you're absolutely key and spot on there that yes, some women may not even recognize it. Like this is what I'm going through. It's dysfunctioning from it, or should I call it a dysfunction or distress? I should
Mhm.
continue to push through because I should want this and I should want that desire from that. But having that low or absent interest from it, especially when it was there prior to, like, okay, let's explore this a little bit more from it. Low desire doesn't mean you're broken. Low desire that causes distress is always worth evaluating from it. That you wanted it, but it's not there from it. Hormone changes in perimenopause can do that. Sleep disturbance, disruption that we talked about can do that. Stress, pain with intercourse can absolutely do that, and any emotional burnout with those. And that's different than arousal from it. Difficulty becoming aroused from it because there's reduced lubrication from it or not mentally present there. My mind wants it, but my body won't respond. And when
Mm.
those two things disconnect, like it hurts. Things
Yeah.
from it, and you feel like, okay, so what's going on? Like what's going on with me? Why is it me that's going on? That this is happening to. And ironically, this is happening to a lot of women and things from it. We're talking more and more about it and not keeping it behind the closed door from it. It's important to find you that circle from it, that podcast that you're listening to, that book that you've read that where you can, if it's someone that you're not able to talk to physically or listen to, that can give you that additional support. So, okay, girl, like let's talk about this. Let's go into it a little bit more from it. It's ironic when you talk about with the men, like men would has this trend of like, especially younger men and like, the numbers and age and what are you doing? And, that seemed to be a thing for men to talk about across intercourse across the board. But we're women, we were taught to kind of keep that behind closed doors from
Yeah.
it, not to discuss this from it. It's shameful. Or why are you doing X, Y, Z? And it's time for us to come back from behind those closed doors and to discuss it and to name it. Not everybody needs to be in your business at
Mhm.
all. Not everybody you can talk to, but
Yeah.
to open it up and to identify those is key.
I love this conversation. Like, I personally will have to be listening to this recording again because it's really getting me to think outside the box with this. And I think that's the part of like that Facebook post I saw. Like, we didn't know all these things were going on. And maybe because there's not a one size fits all. Like,
Yeah.
so it's like we're not aware of how our body is changing. But one of the things I did want to even dig into, which we've kind of discussed a little bit, is about the emotional and mental health side. So, beyond physical symptoms, many women describe feeling disconnected from their bodies or even themselves. What's happening emotionally during this transition, and how can women give themselves more grace through this time?
Grace, amen, amen. Yes,
Yes.
the grace is so key. From we talked about with our estrogen levels, estrogen, progesterone, and testosterone is our main hormones that we're dealing with. But when estrogen directly influences our serotonin, our dopamine, our norepinephrine, that's our feel good. from our mood and things. So when estrogen fluctuates, you can have those mental health shifts from it. Not something that you asked for, not something that you signed up for, that kind of shows up unannounced from it. And it's even if you've been depressed before or even not been depressed, it can show up differently and from another stronger component. And it's important to name it, to recognize that from it. Am I having intrusive thoughts from it? Am I having panic symptoms? Or signs? Or I'm going to the store and everything gets overwhelmed to me by myself, and it looks totally different from those. These symptoms can, if they existed before perimenopause, it's important to discuss them during perimenopause. Absolutely, because those things can intensify from it, especially if there's a history of mood disorders or hormones that didn't fully resolved from his friends or postpartum is a huge area in things from because we've already got hormones that's fluctuating quite a bit, and we have this same thing that's going on in our perimenopause stage as well. So it's important to name it and to recognize it from it. Some women would, many say like, I'm not sad anymore, but I'm not really me either. From it, that not being able to name it, that where you may, feel depressed or have that reduced interest in intercourse or intimacy from it. Even disconnecting from your core group of friends that you had from it. You used to go out and do things from it and hang out with them, and now you're off to yourself and you don't want to see that. The other thing that can hit us hard in the perimenopause stage, when we think about from a mental health period, we talked about before with the estrogen levels and things fluctuate, and during this time frame we'll also notice that our body changes. Weight
Mhm.
distributes in places that and I didn't want it to be from it. My appetite changes, metabolism is slowing down. So it could make us feel that who are we in our bodies from it? Like, where's Shakeeka? I think that where was she? Like I knew her really good 5, 10 years now, but who is she today? And that messes with your mind. That confidence that you have from it, body image changes, confidence, self-esteem can all be impacted and kind of pulled into that mental health. I'm a huge component of therapy from it, whether it's going to speak with someone, whether it's journaling, whether it's, praying about it, because you can seek so much guidance and healing from it. And then being able to get it out on paper as well. And it's so, so, so important and so life changing and heart running from it. It changes your life at the moment, but it changes you for the future of resetting that.
And I think something that from hearing your shares and your advice and tips, like it makes me present to the fact that having these conversations might be uncomfortable. But ultimately, it's like by not having them, like what will be your quality of life when you're experiencing this? Like the emotional changes plus the hormonal changes plus like the physical changes, like all of those things are occurring, but if we're not actively talking to anyone about it, and I feel like definitely, like, from the generations before me, like, there's this, like, we persevered through it all, and we're in 2025. You don't have to, like, talk to someone, get the support that you need, have the conversations with your partners so that you can, like, almost reclaim the narrative because I feel like there's this
Mhm.
negativity around going through perimenopause or menopause or postmenopause, like, there's all of this that's going through it. We have the shame that we're having it in the form of the way we're experiencing it. But ultimately, we can experience something different if we allow ourselves the space to have it.
Absolutely. I mean, you can need support without being broken, in
Yeah.
quotations. You can ask questions regarding a prescriptions or process that's been handed to you. You can ask for sexual health from it and for it to matter from it.
Mhm.
That's important. You can want relief and pleasure at the same time, and that's okay from it. Your mood matters from it. Your hormones matter. Your sex life matters from it. And you don't have to give up one for the other from it. They can treat and be coexist at the same time. And it's important for you to name that and to recognize it.
And when we're talking about treatments, are most treatments going to be in the form of prescriptions? or are they also some natural remedies that can be used as an alternative as well?
Yes, it's a great question. It can be a mix of both, and
Okay.
it's truly individualized. From it of hey, which pathway do I want to go? Do we want this to be prescription based? From it, do I want to do some lifestyle changes with it, or during different supplements or lubrications? From it, and you can do both. From it, I'm a huge component of just because we start one thing doesn't mean we have to end with that or continue with it as well. We can switch things up or kind of go back and take that step forward as need be. But I always like the individual approach because we are individual women from
Mm,
it. We all experience things differently. Even if we have the same exact symptom, I can have a symptom of hot flashes and you can have the symptom of hot flashes, and we experience them two totally different ways, which also means we can treat them two totally different ways from it as well. Always thing I like to encourage is that finding your sweet spot. You can find your sweet spot with treatment today and it works totally fine. And then 3 months down the road, 3 years down the road, we have to change it because your body is always evolving, and it is our role to adapt and to listen. Our body is that internal thermostat. Say, "Hey girl, I'm still here from it. Did you see that red flag I just in there? You didn't slow down a little bit. You still move a little too fast." And from it is protecting us and giving us those cautions, that stop sign for things to be there, and it's our role to listen. So you could absolutely have a combination of prescription and that you want to go down, or no, hey, I want to do more lifestyle changes from it. I want to look at these supplements from it, or I want to look at what can I do to kind of bring in or to bring in my partner. Even going through therapy that we talked about before, that's a prescription I'm often writing. Things are like,
yeah.
hey, let's refer here, let's do this, because it's a partnership and it's collaboration from it as well. No matter what pathway that you take, it takes an open mind from
Mm,
it. An open mind for you to say, hey, I want to do this. I want to try this out. And for you to have all your expectations laid out from this. What am I trying it? Why am I trying it? How long before I see any effects from that, or, relief from it as well? How do I know when I need to contact you as a provider, or I need to contact anyone? Asking those questions. And that's not only for in perimenopause, but across life ahead. Somebody gives you an antibiotic. Okay, why am I taking this from it? What is it used for? How do I need to take it? How do I know when I'm gotten better or I need to come back to see you? Those are super key and important there from it as well.
and I think, like, when I'm hearing you share, I feel like you're almost like your therapist, your clinical practitioner, and your partner are now your BFFs. And 'cause, like, I can only imagine, because I know, so like I said, I have a few friends and family members that are going through it right now, so I only see one side of the octagon of all the things that are going on. I think that if we really embrace the fact that we don't have to, because I feel like that's what some people do, is like they feel like they have to like trudge through, instead of actually realizing that they don't have to and they have resources around them that can actually support them, in the way that is necessary. And I think that when we see it that way, it allows for us to almost reclaim the narrative about our experience with it, because one of the questions I did have, it was like, if a woman feels like her body is betraying her, how can she begin rebuilding trust within herself during this chapter? Which is totally aligned to this, because all of these things are going on. But if we're not talking to our doctor, if we need to work with a therapist, if we have a partner, we should be having conversations with them as well as having conversations with ourselves. But, like, how can we actually start rebuilding the trust in what we're going through in this specific season?
As I mean, there's a key component, and it's going back and getting back to trusting yourself. Because when you're going there's like, oh my gosh, like who is this girl? Like what's happening? And things from it, you start to doubt. And if you add them, like I've had X, Y, and symptoms. I went to this provider. It's like, okay, keep pushing through. This
Mm,
is normal. From it, you start to doubt yourself, and that
yeah.
trust has to be rebuilt from that. So journaling it, naming it, finding you a good provider from it, and sometimes that may take you a couple of times, and that's okay from it. That you may start with provider A and like, okay, this started out great, but now it's going to the left. Let me go to someone else. Do that from it. Your body is going to thank you. I am a huge advocate for when, especially when you have a partner, life partner, husband, your wife, for these conversations to go to your appointments together.
I was
Oftentimes, I'll
going to
treat
ask you
couples
that.
together. Yes, I'll treat them together because, often when I'm sitting and I'm talking to the woman and things from it, she may forget things that he's gonna chime in on. But then when
Mm,
it's his turn as well and I'm talking to him, he's gonna forget those similar things. So
mm,
it's the synergy that comes together, and that helps so much with the partnership because then you know what? She has my back. He has my back. Oh, we have each other's back in here from him. We're in this together. As we are going through perimenopause and the menopause day and postmenopause, men are going through andropause from it. They're having changes that's happening into their bodies as well too. And from it, oftentimes they'll say like, I don't have my morning wood anymore. Okay, I want that back. And things from it.
I
Where'd
love
it go? I want that back. So,
yes.
she's chiming in on it as well too. And that's the beauty a part of this of kind of when we talk about like perimenopause and we talk about intimacy, this is partnership from it. Because what happens, what I've seen it to where like, hey, I've had one partner and now they're on the high from it. They're feeling great. But now the other partner's not able to keep up with them. But when
Mm,
you work on it together and things from like, my goodness, that intimacy that we talked about, like you see them in such a different life. And it even doesn't have to be physical
mm,
from that. You see them different. Like, oh my gosh, oh, he took that trash out, but that trash looked different today than what it did. Oh, well, she brought me this coffee. And from it, you look at things and then it's that respect and the mutual. And to be 100%, transparent, those things are often more impactful than the physical piece of it
yeah.
from it. 'Cause, yeah, like that stays with you. That gives you that desire, that drive from it. So when you feel that you've lost yourself from, or you feel like you're losing yourself, I always encourage you to take a step back with
Uh-huh.
it. Look at yourself in the mirror and talk to yourself. Give yourself that self-talk, that pep talk. I have to do it every single morning when I get, okay, girl, you got 4 patients today from it. We're going to do this from it. Or like my kids got up and they got up on the wrong side of the bed. Don't allow their wrong side of the bed and to impact what you've already have going on. And I think what one of the most important things I've learned when you're trying to refine or redefine who you are or locate that person is identifying time in your day, every single day that's just for you. Whether that means getting up earlier, whether as you stay, a little later from it, or you are in your driveway sitting in the car but you hadn't put that garage door open so everybody hears you, that you're sitting there and you're absorbing that. Give yourself that time from it to really identify your plan, your process, to learn you. Because you do, like you're reintroducing yourself to yourself from it because you've changed and comfortable with who we were from it and not who we are becoming. And that's the key.
This has been so encouraging. I'm so grateful for you being a guest and being a yes, because like I feel that the things that we discussed today are truly missing in the conversation. I mean, whenever I see the Facebook post or the threads post or the TikToks, I always see a reference of it from almost like a sense of being disempowered in this stage when we can actually have power going through this change because we don't have any way to get around it. I mean, is there a way to get around? Like,
It's inedible. Thanks, Charlie. It's going to happen
so like,
intentionally or unintentionally. It is going to happen.
I'm like, so we're all gonna have to go through this. So it's like, how can we actually change the narrative? And I think you've given us some tips and advice so that we're able to change the narrative, not just with ourselves, but with our partners, so that we can embrace intimacy. Because one of the biggest parts of intimacy is vulnerability and to allow
Okay.
ourselves to connect with others. But if we don't even know what's going on, or a person doesn't know, they just thinking you're going crazy. I mean, because I've heard, like that's how sometimes I feel like, oh, she's going crazy. Everything's pissing her off. Like it's because they're not in the conversation. And
It's
so
it.
it's outward conversation is hidden.
Oh my goodness. You could think about it. When it was a client I talked to last week regarding it, and we were talking about the same topic. And the analogy we talked about was like our bank accounts. from it, and how we can, when we don't look and we don't walk into like our bank account from it, that does not change rather how much or not much money you have into that account from it. You're hiding, you're running from that. You're just like, oh, if I don't know, it's not there, or I feel like it's not there, but it doesn't take it away from it. It's just behind a closed door. And this is that same thing of like that communication. I've got to be able to open that door. Sometimes when you open that door, that it's a crack. Things from it. It doesn't have to be wide open all at once, and it can be gradual. And that comfort for you and for that person is important from it. So if for you, like, hey, I just want to crack this door open and it's just open a little bit, and I'm just a little bit of breeze is coming through, and I've gotten comfortable with that. Okay, now I can get my foot into the door, but we're just there. Take those baby steps that you need. Don't feel that you got to open it completely open or open the door and 4 or 5 windows. Take the steps from it as well. Just because you're ready doesn't mean your partner or your family is ready from it as well. So taking those steps with it, and it's like, hey guys, like this is what I'm going through, and I just want to make you aware, and leave it there. Don't lay out your expectations. I want to make you aware and invite them into that conversation from it as well. So that it doesn't feel like a demand. And from
Yeah.
it feels like a partnership. It feels like communication from it. It feels like I care for you from it, and I know you care for me, and we're in this together. So being able to open it.
Fantastic. So share with people how they can learn more about you and connect with you for more advice and support.
Yes, I love it. So you can find me on all social media: Facebook, Instagram, and TikTok is under Thryva Wellness. It's THRYVA, and then Wellness WELLNESS. I post on there. Love it. It's just an opportunity just to share from it and just to kind of showcase, whether it's a video or it's a static post or comments and DMs. It's my heart and joy. I also have the Midlife Reset is a school community that is open up. You're able to come in and to kind of share our experiences together. We learn, I post different things from it and collaborate to truly be in a community with other women and to learn. Like, we thrive in community. We were not made to be on this earth to be alone
At all.
from it. So being in community with others is so important and so key, whether it's a physical community or a virtual community that is there. On LinkedIn is under my name, Shakeeka Misher, and it's DNP listed afterwards, but you can always find me there. And then my website is www.wellnessthryva.com.
This has been so amazing. Thank you so very much again. And I look forward to seeing all the great comments and how this is going to impact a lot of the listeners and the women in this community to just really feel more empowered when we're going through intimacy, rechange how we're thinking about sexual dysfunction. It's not only for men.
That's right.
And learning that we have 20 years of this, everybody.
Buckle up, right?
So let's not struggle through this and just to lock arms together. So thank you again for being a yes.
You're welcome. I appreciate the invite.
Wow, what an amazing conversation. If this conversation has resonated with you, I want to invite you to participate because your voice matters too. Comment below with one change that you've noticed in your body in this stage of life, whether it's physical, emotional, or something you're still trying to put your hand on to understand. Your comment might be the confirmation that another woman in our community is looking to know that they're not alone. And if you want more honest conversations about life, health, purpose, and confidence after 40, subscribe to the Life Over 40 podcast today and join the community so that we can go through this season together.